Module Overview. This module explores the complex interplay between psychosocial factors and youth substance use, emphasizing the dynamic balance between risk and protective elements that influence young people's decisions, behaviors, and resilience. The module draws from fields including developmental psychology, public health, sociology, neuroscience, and education, and aligns with standards from UNODC International Prevention Standards, WHO's Health Promoting Schools Framework, CDC's Social Determinants of Health Guidelines, Nigerian Educational Research and Development Council, NRDC. Life Skills. Curriculum CPD/NVQ Level 4 in Youth Risk Assessment and Intervention. This module provides tools and frameworks for analyzing psychosocial influences and for designing evidence-based, youth-centered intervention strategies that are developmentally appropriate, contextually relevant, and socially inclusive. Key areas of focus in this Module 1. Definition of psychosocial factors. Psychosocial factors refer to the combined influence of psychological development and social environments. These include family dynamics, peer influences, community environments, mental health status, social support, educational experiences, and economic conditions. Psychosocial factors can act as either risk factors, increasing the likelihood of substance use, or protective factors, shielding youth from substance-related. Second, major psychosocial risk factors for youth substance abuse. A. Family-related risk factors: poor parental supervision, family conflict and domestic violence, parental substance abuse, absence of strong role models, inconsistent discipline. B. Peer and social risk factors: peer pressure and the desire for social acceptance, association with drug-using peers, bullying or exclusion, social media glorification of drug use. C. Psychological and emotional risk factors: low self-esteem or self-worth, anxiety, depression, or trauma history, impulse control problems, identity confusion, unresolved grief or loss, educational and institutional risk factors: school failure or academic disengagement, lack of positive teacher-student relationships, unaddressed learning disorders, negative school climate. E. Community and environmental risk factors: high availability of drugs in the neighborhood, exposure to violence and crime, lack of recreational or safe community spaces, socioeconomic disadvantage, cultural stigma around seeking help. 3. Key psychosocial protective factors. A. Family. Protective factors: supportive, communicative family relationships, positive parental role modeling, consistent rules and boundaries, involvement in the child's life and education. B. Individual-level protective factors: high self-esteem and self-efficacy, strong coping and decision-making skills, awareness of drug risks, resilience and emotional regulation. C. School-based protective factors: safe and inclusive school environment, involvement in extracurricular activities, connection with caring adults, mentors, counselors, academic engagement and success. Peer and social protective factors: friendships with pro-social peers, positive peer norms around sobriety, belonging to faith or civic youth groups, supportive adult mentors. E. Community-level protective factors: access to safe recreational facilities, community cohesion and support networks, youth empowerment initiatives, access to youth-friendly health services. The balance of risk and protection. The resilience equation. Youth with many risk factors but few protective factors are most vulnerable. Those with risk factors but strong protective buffers, e.g. mentorship, support groups, are more resilient. Prevention efforts must reduce risks and build up protective shields simultaneously. 5. Developmental timing of risk exposure. Risk exposure during early childhood, ages 0 to 5, affects brain development and emotional attachment. Middle childhood, 6 to 11, peer and school-based risk begins to emerge. Adolescence, 12 to 19. Identity formation, independence, and susceptibility to peer norms peak. Interventions must be age-sensitive, culturally appropriate, and gender-responsive. 6. Contextual and cultural considerations. In African and Nigerian settings, extended families can be both protective and risky. Substance use may be linked to rituals, beliefs, or rites of passage. Youth may turn to drugs due to poverty, unemployment, or hopelessness. Spirituality and traditional values can serve as resilience tools when integrated appropriately. 7. Tools for assessing psychosocial risk. Youth Risk Behavior Survey, YRBS, Strengths and Difficulties. Questionnaire, SDQ. Adolescent Risk Indexes. Clinical interviews and counselor assessments. Observation in schools and communities. Practical application. You will conduct risk protection mapping in hypothetical youth cases. Build intervention plans that strengthen protective factors. Propose community initiatives that reduce psychosocial stressors. Advocate for youth policies that support psychosocial development.